This is a presentation, though, that is not my presentation. It is designed for you. It is a presentation and a PowerPoint deck that is going to be available for you to take this with narration out to your communities, whether it's community outside of Little Rock or whether it's your particular area of profession, teachers, whatever, early childhood and so forth. The key with ACEs is we need to get people informed and be aware that this helps us with so many of our problems that we deal with today. So I'll go through this pretty quickly because it's an hour presentation. So with that, I will try to get coordinated here. The goals will be to describe ACEs. If you haven't heard, how many have never heard of ACEs? If you're here, you probably have, so that's good. Understand the effects of ACEs, detect some of the symptoms of trauma associated with ACEs, and most importantly, what we want you all to do after this conference is to be energized to go out there and spread the word and the knowledge so that we can incorporate action into our awareness. Awareness, knowing something is useful, but unless it's accompanied by action, we won't be able to make progress. This is the presentation is a great animated presentation, and it's a story of Elijah. It's based on the story of Elijah, who happens to be a 50-ish guy from Waldron, Arkansas, and it's his story. He's got a number of medical issues, including obesity, which is not an unusual problem in Arkansas, as well as smoking and a number of other issues. So the issue is what happened to him. We have to reframe our thinking about many of our problems that we have had standard answers for and standard responses to. Speak up. Can everybody hear me? Okay. So, no? Really? Oh, okay. I will talk louder. I thought I can hear my ringing in my ears up here because it's really loud up here. But anyway, the question that we need to reframe in many of our issues when we have a child, a family, a student that we're having issues with is to understand, change our question from what's wrong with that person to what's happened to them. Physicians like to make diagnoses, and I think we have gone very far with our understanding in making diagnoses. That doesn't mean they're irrelevant, but understanding what happened to somebody's history, which has always been part of medicine. This is a history. What's happened to somebody is critical. In our new technology days with all kinds of laboratory stuff, I think the art of doing a history, and really ACEs is the history of what happened to somebody when they were young. So the question is, how many ACEs have you experienced? And this is what the questionnaire is about. And it's based on a study that was done and is ongoing by Folletti and Anda back in the 90s, where they were working in an obesity clinic, and they found people lost weight and gained weight, lost weight and gained weight, lost weight and gained weight, and they wondered why. And they began to look at the history a little bit more detail and found out, there was something going on, particularly with regard to adversity or events, including physical abuse, sexual abuse, and emotional abuse in childhood. And so they developed the survey, which is the 10 questions you have, which is the classic survey. It's not by all means the only questions that are important in understanding adversity, but it is the 10 classic questions. And we have a lot of data on these questions. So they studied and correlated the answers to those questions in 17,000 patients and followed them over time. Pretty impressive study. Longitudinal study, which is what is missing in a lot of our issues today, is we don't have a chance to look over time, over the life course, what's going on. They found physical abuse, emotional abuse, and sexual abuse are obviously trauma. Then you have neglect, physical and emotional neglect. A little harder to define, but the questions you can look at get at those issues. And then you have what they call household dysfunction, such as incarceration. When a parent's incarcerated, this causes major problems for the children of that parent. And so incarceration is one of the high ones that we deal with here in Arkansas, because our incarceration rates are very high. Mental illness in the parent, anything from perinatal depression and mood disorder to more significant. Substance abuse. One of our problems today is opioids. A lot of that is related to some of the issues we'll talk about. The mother being treated violently is an important issue. And divorce, again, very common. So on your questions, basically it doesn't ask you to document, it asks you, what do you remember, which is the historical information. So figure out your scores, and we'll talk about what they mean. Understanding ACEs requires us to reframe some of our classic thinking about trauma. Trauma is a spectrum. Physical trauma is obvious. I'm an old pediatrician, and I trained with some of the best old pediatricians at the University of Colorado, Kemp and Silver. And in those days, they would put up an x-ray of a kid and look at the bones and say, hey, there's a bunch of fractures here. You mean something could be going on? This wasn't that long ago when we first recognized what was called then as the battered child syndrome. We've come a long way since then, but that is just one end of the spectrum of physical abuse and abuse. The rest of it has to do with something we call toxic stress, and I want to talk about that. This is reframing our thinking, because we think stress is good. Yes, stress is good. There is positive stress, which we all need to get our job done and stay on track most of the time. So there is positive stress. There's tolerable stress. Tolerable stress is stress that is a little more prolonged and more significant. And then there's something called toxic stress, which exceeds the capacity of the individual to adapt to the environment. It's particularly an issue when it is combined with periods of vulnerable brain development, which is the first 3 years of life. The problem with the ACEs questions are you can't remember anything that happened to you before you were 3, so it's really underestimating what's gone on. Anybody remember when they were born? Anybody remember anything less than 3? You probably have vague memories, but the brain actually cannot remember, because developmentally that part of the brain is not working. So I'm going to show a quick video which I think illustrates this, if it'll work. Push the next button.
The reality is that we all need a certain amount of stress, a certain amount of anxiety to perform well. If we don't care about that exam that we're going to have tomorrow, we'll probably fail. If we're going to cross the street and a truck is coming at us, we have release of adrenaline. We have release of a hormone that we call cortisol. We want to jump out of there, and adrenaline and cortisol are going to help us do that. So there's that good amount of stress. But if all day long you're feeling like a truck is coming at you, day after day after day, that's going to take a toll on the body. And the amygdala obviously here has greater activation.
Yes.
In the PTSD. We were able to image children that had experienced trauma and compare those brain images with children that didn't have an experience of trauma and didn't have symptoms.
Right, an exaggerated fear response.
An exaggerated fear response with decreased activation in areas that we need to control that emotion, in the frontal areas.
Exposure to early adversity and trauma literally affects the structure and function of children's developing brains. So the kid next to them hits them, or the teacher reprimands them in a way that they're uncomfortable with, right? literally what they're feeling, that activation, is like there was a truck coming at them.
This clip is from a documentary called Resilience. If you haven't seen the whole thing, and you can probably go ahead and figure out a way to get it online, I'd recommend it. But that's a good illustration of what toxic stress is to deal with. And the important part of it is that one of the criticisms I sometimes get when I talk is, well, you're saying that an individual has no personal responsibility for his behavior. Is that what you're saying? No, I'm not saying that. I'm saying that what's happened to you during the early years, a baby does not choose his parents, does not choose where he was born, does not choose his environment. So a baby has no personal responsibility. His parents have responsibility, and we, I think, collectively as a society have responsibility to make sure that baby's brain gets what it needs. So babies' brains develop very rapidly, and they're very vulnerable from conception to the first couple years of life. You can see that the number of neurons increases, and the connections, most importantly, between those neurons increases and forms. And actually, what forms first developmentally is the social-emotional issues that are more important than the cognitive. Oh my goodness, now I'm saying really radical stuff. Social-emotional development is more important because without good social-emotional development, you cannot have good cognitive development. They are related. There's not a social-emotional part of the brain and a cognitive part of the brain. So toxic stress interferes with this. Interferes with the ability of the baby to respond appropriately to stress. And here you have an example of extreme neglect in a normal brain. That's extreme case. You can see the brain smaller, and that's something we've known for a long time. But what we didn't know is how to connect this early life adversity or toxic stress to the problems we saw in the Anda and Folletti study, which are disrupted neurodevelopment. Toxic stress disrupts neurodevelopment. So, how do we take care of mothers and babies in our society today? Are we all interested in preventing and protecting them from toxic stress? Whose responsibility is it? Certainly the father, the family, but also the community and the society and the culture, I think, should be responsible. So, social, emotional, and cognitive impairment. That leads to high-risk behaviors. You say, well, these people do things like take drugs and so forth. Why do they do these things? Part of that is in response to the fact that their circuits of the brain have been interfered with by toxic stress. So you have high-risk behaviors, which then make everything else worse. Then you have disability and social problems and disease and early death. So if you look at all of our problems today, from obesity to coronary artery disease to mental illness to the fact that today we have 30 to 40% of kids in our society have a developmental, mental, or behavioral problem. 30 to 40%. If this was Zika, we'd be running around with our hair on fire about Zika. This we know is going on, and it's probably the root cause of these things. So we should change the question when we look at a child or a family or a mother or a father or parents. As a pediatrician, I always would say, if they only listened to me and did what I told them to do, they would be better. But I wish I knew then what I know now, which is it's not what's wrong with them, but what happened to them, and trying to understand. Not excuse, but to intervene. And there are things we can do to prevent and to intervene, which we'll talk about. So what happened to Elijah is he saw his father arrested for meth. His mother was depressed. Teen mother thrown out of the house. Grandparents had nothing to do with him. Homeless for a significant period of time. Housing insecurity, food insecurity. Having a baby today is difficult with the best of support. Imagine that kind of an environment and that kind of a community that has no other support for that child. Too often I say, that's why I'm a promoter of WIC and our interventions that we're doing in the WIC clinic, is in the hospital, everybody's born in the hospital. This is good. I came from China, and not everybody was born in certain areas of China in the hospital. But we keep them for 1 or 2 days, give them a bunch of papers, throw them out, and say, hey, good luck. Here's the WIC clinic, here's Medicare, Medicaid enrollment, and so good luck, Mom. Go find a PCP, see if you got insurance, can work all that out. And we don't really have any input into that child until preschool. And then we wonder why the kids are having aggressive behavior, getting expelled from preschool and not doing well. Or we wonder why they get referred to DCFS and child protection, and our foster care system is overloaded. We wonder why. Because what else are we doing for that young mother, family, and baby? What else? So, again, behavior, physical and mental health, all these things have been associated with early life adversity. And the numbers are pretty impressive longitudinally. Associated doesn't mean cause and effect, but we're beginning to see the pieces. We're beginning to see the pieces. So even your lifespan is shortened. If you have 6 or more ACEs, you may lose 20 years on your life expectancy. Not necessarily written in stone, because there are things we can do to develop resilience, which is the other side of the questionnaire. So Arkansas, our situation in Arkansas compared to US is pretty alarming. We have more positive of drug and alcohol, death of a parent. That's an interesting statistic. Why are we have more deaths of parents in Arkansas based on these surveys? Divorce, separation, mental illness, neighborhood, and witnessing violence, which I'm sure Dr. Pinterhughes is going to talk a lot about, because the community is critical. Toxicity exists not only within the family, but also within the community. Extreme economic hardship, race and ethnicity inequities. Parents spend time in jail. Arkansas's numbers are high, which puts us in one of the highest categories of prevalence of adverse childhood experiences in the country. In the country. So based on these studies, Arkansas is not a good place to raise a child. So we need to work on improving that. So detect symptoms early. What kind of symptoms? Aggressive behavior, inability to regulate emotions, not doing well in school. And how many teachers in here? No teachers? Okay. You know, I haven't been in elementary school for a while, so I spent some time with a school nurse watching what she's doing and what kids come into her office. It's pretty, how many school nurses? School nurses. How many school nurses? So what happens? All these behavioral manifestations, failure of school to do well in school, are related. A kid who's been traumatized is not going to do well in school because the parts of his brain associated with learning are not developed. So he can't do well in school. So you're going to have aggressive behavior. You're going to have learning disorders. And what you can do to help that is, we know that resilience is based on relationships. So anybody that can form a positive relationship with that mother and child can have a big effect on mitigating the effects of the adversity on the developing brain. So early, high quality, affordable childcare, preschool, quality preschool, positive relationship with any significant adult who can support that child. So when you interface with the child, you have the opportunity to be a positive influence and to increase his resilience score. So look at your resilience factors, because it's really the balance. It's really the balance between the adversity and the resilience. Because you all have heard of stories, and this is what we often say, well, this guy came out and did well despite all the adversity. But if you look back on any of those, there was always one person. If it wasn't the mother, if it wasn't the father, if it wasn't a teacher, it was somebody in their environment that could provide that child the relationships they need. Because social emotional development is based on relationships. So, we can all be buffers. We can screen, and we can understand if we have a problem case in our particular arena that there's something going on here, and approach it in that fashion. Screening is something that I think we need to pay a lot of attention to and needs to be done in the context of many environments, including the pediatric clinic. The question for us pediatricians is always, any pediatricians in the room before I say anything else about pediatricians? Is always, we got to screen for so darn many things, and they're always adding to the list, and we don't have time, and that's true. But I would tell you, the first thing I'd want to know if I'm taking care of a mother and baby today is what the ACEs score of that mother is, because it would help me support that mother and be a better pediatrician. So, screening, I think, is important. We need to educate ourselves and families and communities with ways to deal with stress. Prevention. There are certain interventions that are very useful. And a lot of work has been done by Dr. Burke Harris in San Francisco. So, and obviously refer to services. But our services are not sufficient in general. If I was a pediatrician today, I'd like to see us do this. I'd like to see us develop a pediatric clinic with a psychiatrist, psychologist, social worker, care coordinator under one roof, taking care of these kids, because what they need is a multidisciplinary approach. A pediatrician by himself cannot do this. He needs a team. And I think we need to move our healthcare system to develop services like that. So we need to learn from each other and tell others what you have learned. This PowerPoint is available for you, and it's got a good narrative. You can probably do a better job than I, because I didn't follow the narrative very well. And that's all I have. If you have any questions, I'd like to be glad to try to answer a couple, right? We have no questions?